Kidney stones, also known as renal calculi, are hard deposits made of minerals and salts that form inside the kidneys. They can cause severe pain and can affect any part of the urinary tract, from the kidneys to the bladder. The stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Types of kidney stones: calcium stones. The most common type, usually in the form of calcium oxalate or calcium phosphate. Oxalate is found in many foods, and excess consumption can contribute to stone formation. Struvite stones. These form in response to an infection, such as a urinary tract infection (UTI). They can grow quickly and become large, sometimes with few symptoms. Uric acid stones. These occur in people who lose too much fluid, dehydration, consume a high-protein diet, or have gout. They form when urine is too acidic. Cystine stones. These are rare and occur in people with a genetic disorder called cystinuria that causes cysteine, an amino acid, to leak into the urine. Causes and risk factors: kidney stones can form due to a variety of factors, including dehydration. Not drinking enough water leads to highly concentrated urine, increasing the risk of stones. Diet. High levels of oxalates, sodium, or animal protein in the diet can increase the likelihood of stone formation. Family history. A personal or family history of kidney stones raises the risk. Medical conditions. Conditions like hyperparathyroidism, gout, and recurrent UTIs can contribute to stone formation. Certain medications. Some medications, such as diuretics, calcium-based antacids, or topiramate, can increase the risk. Obesity. Higher body weight and certain metabolic changes can contribute to stone formation. Digestive diseases and surgery. Conditions like inflammatory bowel disease or surgeries such as gastric bypass can increase the risk by altering the digestive process and affecting calcium and fluid absorption. Symptoms. Kidney stones often do not cause symptoms until they move within the kidney or pass into the ureter, the tube connecting the kidney to the bladder. Common symptoms include severe pain, known as a renal colic. Pain often begins suddenly and is felt in the side, back, or below the ribs. It may radiate to the lower abdomen and groin. The pain can fluctuate in intensity as the stone moves. Painful urination. A burning sensation when urinating, particularly if the stone is passing into the bladder. Hematuria. Blood in the urine, making it appear pink, red, or brown. Nausea and vomiting, due to severe pain or kidney irritation. Frequent urination. An increased urge to urinate or urinating small amounts frequently. Cloudy or foul-smelling urine. This can indicate a urinary tract infection along with a stone. Fever and chills. These are signs of an infection and require immediate medical attention. Diagnosis. To diagnose kidney stones, the doctor may use several tests. Imaging tests. CT scan, the most sensitive test to detect stones. Ultrasound, often used for diagnosis, especially in pregnant women or for follow-up. X-rays, though less effective, they may sometimes detect larger stones. Urine tests can detect substances that promote stone formation or signs of an infection. Blood tests. These tests can reveal high levels of calcium, uric acid, or other substances that could contribute to stone formation. Stone analysis. If a stone is passed, it can be analyzed to determine its composition, helping to prevent future stones. Treatment. Treatment for kidney stones depends on the size, type, and severity of symptoms. Many small stones pass on their own, while larger stones may require medical intervention. Drinking water. Drinking 2 to 3 liters a day helps flush urinary system and may assist in passing the stone. Pain relief. Over-the-counter pain medications such as ibuprofen or acetaminophen can help manage pain. Medical therapy. Doctors may prescribe medications called alpha blockers such as tamsulosin to help relax the muscles in the ureter, making it easier to pass the stone. Shockwave lithotripsy SWL. This non-invasive procedure uses sound waves to break larger stones into smaller pieces that can be passed in the urine. Ureteroscopy. A small scope is inserted into the ureter and bladder, and the stone is either removed or broken into smaller pieces using a laser. Percutaneous nephrolithotomy. For very large stones, this surgical procedure involves making a small incision in the back to remove the stone directly from the kidney. Surgery. Rarely, large or complicated stones require open surgery. Preventing kidney stones involves making changes in diet, hydration, and addressing underlying health issues. Hydration. Drinking enough fluids, about 2.5 to 3 liters daily, dilutes the substances in urine that lead to stones. Dietary changes. Reduce salt, limit salt intake, as sodium can increase calcium levels in the urine. Limit oxalates. Reduce foods high in oxalates like spinach, nuts, and tea. Moderate protein. Lowering consumption of animal protein may help prevent uric acid stones. Calcium. Maintain moderate calcium intake, as excessive calcium supplements may increase the risk of stones. Medications. In some cases, medications are prescribed to prevent specific types of stones. Thiazide diuretics for calcium stones. Allopurinol for uric acid stones. Citrate supplements to prevent calcium stones. Treating underlying conditions. Managing conditions like gout or hyperparathyroidism that contribute to stone formation can reduce the risk. Complications. Kidney stones can lead to complications, especially if they are large or untreated. Urinary tract obstruction. Stones can block the flow of urine, leading to kidney damage or infection. Infections. A blocked stone can lead to a severe infection, which can spread to the bloodstream. Sepsis. Kidney damage. Recurrent stones or large untreated stones can cause chronic kidney damage or even kidney failure. Recurrence. Once someone has had kidney stones, there is a higher chance of recurrence without preventive measures. Conclusion. Kidney stones are a painful but treatable condition. Early intervention, pain management, and lifestyle changes can help manage and prevent future stones. If symptoms are severe or persistent, prompt medical attention is essential to prevent complications.